could you tell us a little bit about what EMDR is, what it stands for, and kind of how you work with clients using that modality?
Sure. So EMDR stands for Eye Movement Desensitization and Reprocessing.
Wow, fancy name.
Fancy. That's why they call it EMDR, because you can't say that too many times. It's something that I use very often with my clients. So EMDR, it's a modality of therapy aimed at working on trauma, trauma and traumatic events. Just because EMDR is meant for trauma, that doesn't mean that we can't use it on, well, I like to say that we use it on painful life events, because I don't think that certain things can be labeled as quote unquote traumas, and,
Right.
and that definition is different for everyone. So I use EMDR on painful life events. So what we do in EMDR is we take a memory, a painful memory, and we process it, using eye movements. So sometimes I might move my hand like that and have people follow me with their eyes. Sometimes there's equipment, and then there's also other ways to do the what we call bilateral stimulation. So it isn't always eye movements. It could be any sort of stimulation on alternating sides of the body.
So it's happening while the person is talking about the difficult memory?
Yes. So so what I do is I have someone bring it up, and then we do the bilateral stimulation, whether it be eye movements or what have you, depending on the person. And there isn't any talking while the bilateral stimulation is happening. It happens for about 20 seconds, and then we stop, and then I check in and say, what happened? Where did you go? And then the person gives me an update or kind of a report of where it is that their mind went, and then most often I say, go with that.
Okay.
And then we continue with the bilateral stimulation.
So wait, just so that I'm clear, because during the stimulation or the eye movement, the person is not speaking, they're just they're thinking and visualizing the event?
Correct. So I like to bring up a memory almost as if it is a movie.
Okay.
And then I ask people to pause that movie on the worst part. So I say, what image is on that screen of the worst part of that movie? And then I bring them right there with the feelings and the thoughts associated with that image.
Right.
And I have them start from there. And then we begin the bilateral stimulation.
And then so you pause, and then you move the movie along?
And then so the question I ask is, what came up? And then the client reports whatever it is that came up.
And that's the next frame?
And then most often I say, go with that.
Okay.
And
unless he's thinking about cheeseburgers.
Unless they're thinking about cheeseburgers. And so to speak a little bit more about EMDR, and it's really free association.
Gotcha.
It's free association, and the theory is that the mind takes itself to wherever it needs to be healed. So in painful life events, a lot of that content, a lot of that memory is what we call unprocessed. So it's unprocessed, and so it's kind of stuck there. And while we're doing bilateral stimulation, what we're doing is we're sort of processing or digesting that piece of that painful life event that was never processed or could never have been processed. And we do it in a systematic way, in a safe way, where we can where we can process and get through these things.
Gotcha. Okay. Two questions that come up for me. One, there's been some literature of late talking about how trauma or painful events is not only a cognitive process, meaning it's not only thinking, but it involves thinking, emotions, and a physical body as well. So it has sort of that triad. Do you find yourself kind of noting that? Is anything comes up for these individuals when you guys are doing, focusing on some of the painful events through EMDR?
100%. So when someone brings up a painful life event, we talk about the negative thoughts that they feel, that they believe to be true right now, and we also look at any sort of body sensations that are going on.
Okay.
So we take those two along with the image, and we put that all together, and then that's where we go. And then when I check in with folks, I ask, is there any disturbance? And so what they do is they bring up the image and they notice if there's any disturbance in their body.
Okay.
So it's very common that someone says, oh, I have a tightness in my chest. and then oftentimes I would say go with that.
Okay.
So as we're processing, we're working on thoughts, memories, feelings, body sensations, everything that comes up, because
Okay.
kind of like what you said, that's all tied into the trauma.
Gotcha. Okay. Great. Thank you for that. That definitely clarifies a couple of things for me, and hopefully also for the viewer. Another, I think, big controversy, I would say, in EMDR and what's called prolonged exposure through cognitive behavioral work is what are the actual elements that are helpful to process the trauma. So there's one camp out there of psychologists and clinicians thinking that the prolonged exposure, meaning talking about the painful event at length for a very long time, is actually the healing piece. And there's also, I understand, from an EMDR point of view, that there's specific elements to EMDR that are helpful in addition to the prolonged exposure. So maybe you could, Tim, tell us a little bit about your view on it and why you believe that EMDR does add that unique and valuable component to treatment.
So the exposure piece is, I believe, is really important because, well, every time we expose ourselves to something, it becomes a little bit less powerful.
Mm-hmm.
So I think the exposure piece is very, very important. But I also believe that the bilateral stimulation itself is helpful. And so sort of the theory behind it is REM sleep, right?
Mm-hmm.
So when we go to sleep and we're in REM sleep, we're dreaming and we're actually processing events. And so, like I said before, a lot of trauma is unprocessed.
Mm-hmm.
So kind of the theory is if we stimulate that almost REM state while pairing it with something that has not been processed or digested yet, that actually leads the brain to heal itself.
Gotcha.
So for example, if we're processing a painful life event during a REM cycle, well, we're probably going to have a nightmare and we're probably going to wake up. So it gets stopped.
I see.
And so in EMDR, what we're doing is we're processing the pain a little bit at a time in manageable chunks until we can get through all of it.
So that kind of brings me to a next question. So there's been studies to suggest that the EMDR techniques can actually elicit REM-like state in an individual?
Well, that's the theory behind it.
Okay.
So there isn't a study per se that says that the same exact thing happens in the brain as REM sleep, but
Gotcha.
but that's kind of one of the theories behind it.
Gotcha. That's what happens.
And another piece of it is, we're bringing ourselves back to a painful life event while also focusing on something, usually eye movements, in the present. So we sort of have one foot in the past and one foot in the present. And when we are immersing ourselves in both worlds at the same time, then the theory is we're more able to reconcile it. We're more able to come to grips with it. Oftentimes what I feel is, or what I find is, these painful life events, they get sort of like locked away somewhere. And they get locked away with these certain thoughts and feelings, and most of the times they're untrue. And so when we pull the event out from that locked place and we're able to process it and work on it both there and here, we kind of change that narrative. We change that story. No longer it's a story of me being powerless. It's a story of, well, the narrative changes.
Gotcha. So that I really like that idea because there's some psychologists out there talking about a sense of pendulation. So, and I think that's kind of what you're referring to, is that you're going back to the difficult memory at the same time, pendulating or moving back into the present, and that process itself creates a sense of safety where you're able to process some of the difficult and painful emotions.
Yeah, and so that's EMDR in a nutshell. That's not everything about it, but
Sure.
A lot of folks are skeptical of it, and I was myself in the beginning. I said, "There's no way," but through trainings and in practice, the results have been really, really surprising, even to me and myself. And so it's been something that a lot of patients have really found a lot of really good results with, and now a lot of people swear by it. And It's been really working out for me and a lot of my clients. So it's another piece that I always have, that I can always add in where appropriate.
And I think that's a lot of our viewers and just a lot of people in general are looking for things that work. I think we're in the 21st century, moving away from just contemplation and thinking about things to now we're interested in, like, okay, but how does that work? Okay, but what can I actually do? And I really like cognitive behavioral therapy and EMDR because it creates actionable steps that you can actually take away rather than just, food for thought, which is something that is harder to put into practice. Well, thanks so much, Tim, for sharing your thoughts on your work with kids and families as well as the EMDR. And for you, the viewer, thanks so much for joining, and we'll see you guys next time. Take care. Bye-bye.